Today we'll be presenting on the surgical procedure blepharoplasty. Blepharoplasty means surgical repair of the eyelid. The word breaks down into blepharo, which means eyelid, and plasty, which means surgical repair. This procedure is commonly performed to remove excess skin or fat from the upper or lower eyelids. Blepharoplasty is also one of the most common cosmetic and functional eye surgeries in the United States, with about 115,000 procedures done yearly. It can also improve a patient's vision if sagging eyelid skin is blocking their visual field. The image on the slide shows what the procedure aims to fix and the difference before and after. The procedure's description. Blepharoplasty is performed by an ophthalmic surgeon or a plastic surgeon who specializes in eyelid and facial repairs. This surgery is usually done in an outpatient setting, meaning the patient goes home the same day. During the procedure, the surgeon removes excess skin, fat, or even sometimes a small amount of muscle from either the upper, lower, or both in some cases. Common reasons for the surgery include droopy eyelids, excess skin that hangs over the eyelashes, or fat pads that cause puffiness under the eyes. A diagnostic test often used before surgery is visual field testing, also called perimetry, which measures the patient's peripheral vision to see if the eyelid is obstructing their sight. After surgery, swelling and bruising are normal for 1 to 2 weeks. Most patients recover at home, utilizing cold compresses and prescribed lubrication. Patient-friendly explanation. In simple terms, blepharoplasty is eyelid surgery. It removes extra skin or fat that makes eyelids droop or look puffy. Some people need the surgery because their eyelids block part of their vision, or others choose it for cosmetic reasons to look more awake or younger. It's an outpatient surgery, so you can go home the same day. Most of the healing happens at home, and people usually start to feel better within a couple of weeks. For this section, we included a short educational video from the iSmart American Academy of Ophthalmology. This video explains what blepharoplasty is, why someone might need it, and what the surgeon does during the procedure. It also shows how removing extra skin or fat can improve both the appearance of the eyelids and the patient's vision. This video is helpful for patients because it gives a clear visual explanation of the surgery and what they can expect before and after the procedure. Thank you.
In this case study, we are focusing on a patient named Ms. Rodriguez, a 50-year-old woman who came to the clinic because she was having trouble seeing clearly due to drooping eyelids. The medical term for drooping eyelids is ptosis. Upon examination, her provider also noticed dermatochalasis, which means there was excess loose skin on her upper eyelids. This extra skin was hanging over her eyelashes and blocking part of her vision. Her ophthalmic physician referred to an oculoplastic surgeon, a specialist who performs eyelid surgery. The surgeon recommended a blepharoplasty, which is the surgical repair of the eyelid to remove the extra skin and improve vision. After the procedure, Ms. Rodriguez had mild edema, meaning swelling, which is normal. She was instructed to use cold compresses and apply an ophthalmic ointment to prevent infection. At her 2-week follow-up, her swelling decreased, her vision had improved, and she reported feeling more confident about her appearance as well. For this slide, I will define the medical terminology terms that were used in the case study. The first term is blepharoplasty, pronounced blepharoplasty. This word is built from medical parts. Blepharo means eyelid and plasty means surgical repair. So blepharoplasty means the surgical repair of the eyelid. The next term is ptosis, pronounced ptosis. This term is not built from word parts and comes from a Greek word meaning falling or drooping. In our case study, ptosis refers to the drooping of the upper eyelid. The third term is dermatochalasis, pronounced dermatochalasis. This word is built from parts, dermato, meaning skin, and chalasis, meaning loosening or relaxation. So dermatochalasis refers to loose, excess skin, usually on the eyelids. The fourth term is ophthalmic, pronounced ophthalmic. This is built from ophthalmo, meaning eye, and ic, meaning pertaining to. So ophthalmic simply means pertaining to the eye. The last term, edema, pronounced edema. This word is not built from word parts and comes from a Greek term for swelling. Edema refers to the buildup of fluid in tissues causing swelling, which is common after eyelid surgery. These terms help describe the patient's condition, the procedure performed, and the normal recovery process. For our critical thinking question, we want you to think about blepharoplasty as more than just a cosmetic procedure. Consider how excess eyelid skin or eyelid drooping can affect things like vision, reading, driving, or even eye comfort. You'll answer this question in the discussion after watching our presentation. Thank you.